conducting your cranial nerve examination today. So we will be following a set of strict cranial nerve instructions for today's session. So things may be a little bit detailed, maybe a lot detailed, but rest assured, it's all to make sure that your cranial nerves are working appropriately and effectively. Okay. Now, I've introduced myself. Can I get your name, please? Okay, and your date of birth. Okay, and your address, please. Alright. Okay. Wash hands. So I have washed my hands for this session. So I need to briefly explain to you what this examination involves. So the examination is a series of tests. We look at your olfactory nerve, your optic nerve, your ocular motor, trochlear, abducens nerve, trigeminal nerve, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, and hypoglossal nerves. Now that's a lot of nerves, isn't it? Indeed. So there's strict instructions for all of these nerves to make sure that yours are working effectively. So it is good practice to work sequentially through these cranial nerves. So I am going to be doing this in sequential order. Okay, is there any questions you've got about today's examination? No. Alright, okay, just need to take a quick sip of my drink. Let's get started. So today we are going to be beginning with the olfactory nerve. So the olfactory nerve is involved with your sense of smell. Okay, now have you noticed any change in your sense of smell? Yeah, does normal smells smell differently? Are things smelling more worse than normal or anything like that? Have you had a loss of smell? Anything? Okay, so we're going to use some perfumes today to get you to smell and let me know what you smell now. I'm not looking for you to tell me exactly what it is. I'm looking for you to see if you can differentiate between something that's sweet, floral, spicy, citrusy. Okay, so are you happy with that? I'll smell them first as well, just to make sure that all is fine, and then I'll get you to smell them for me. Okay. Alright, let's begin with this one. Okay, how does this one smell? So, yeah, it's quite aftershavey. Okay. Yes, of course. Yeah, so it's called Fruity Honey, but the name is quite different to how it smells. It's quite a fresh aftershave type scent, isn't it? It's very fresh, it's quite masculine. Good. Okay, I'm glad you got that one, no problem. Alright. Our next one. Sweet. And citrusy. Yeah. Okay, so this one is Pomegranate Noir by Jo Malone. So it is it's sweet, but it's citrusy, it's fresh. Yeah, so that's good that your body was able to pick that out. Or your nose, I should say. Okay, this next one. It's nice, isn't it? Spicy and sweet. Yes, I would say. Yes, so there's a musky spicy, so you're picking the musk and the spice. And the sweet notes too. So this is spicy orchid. So it is that kind of spice with a bit of sweet. Very good. And then we have this one. There's the smell. Very citrusy. Yes, it's a little bit of spice. It's like herby. It is indeed. So this is lime, basil and mandarin, cologne by Joe Malone. It is that citrusy, with a little bit of kind of herby notes through it. So that's great. You picked out that, and your final one here. Yes, very, very, very sweet. Just sweet, yeah. It smells like candy. Yes, so this is floral marshmallow. So it's very sweet, but very nice. Great. Well, you passed the olfactory examination with flying colours. So no issues. There. Okay. So we're going to move on to your optic nerve now. So your optic nerve, we are going to examine this by various modalities. So we're going to start with your visual acuity. So we're going to assess your visual acuity with a Snellen chart. You need to keep your glasses on to correct for any refractory errors. So normally we would stand you 6 meters away from the chart, covering each eye separately, but we are going to do double eyes today, and we are going to use a smaller Snellen chart, which means I don't need to hold it as far back as 6 meters. And then we're going to get you to read as well. There's like a little reading bit on it. So we can also get you to read as well from a book or a magazine. So I might get you to read a little line from something. Okay. So let's do the chart first of all. So this one is to be held about here. Okay. Can you start from the top and read each line for me? E L T F P H O L C F D H J B S E P T Z O C F D H J L T F P H. Great. Now, can you read this paragraph here? The top paragraph. And I'll repeat it, so yeah, just read that for me. So soon, Catalan croon over the crinkling sea. The moonman flings him a silvered net, fashioned of moonbeams 3. Wonderful. So your visual acuity is fine and reading is fine. Okay. So then we're going to look at your visual fields, okay? So we're going to cover your left eye with your left hand, and then your right eye with your right hand, and then you must look straight ahead, so it'll be at my shoulders. And then I'm going to move my hands to your upper temporal visual field quadrant. And I'm going to gradually move the finger to the centre of the vision from the periphery, and I will ask you to inform as soon as you see my finger moving. I'm going to repeat for the lower temporal, upper nasal and lower nasal fields, and repeat on the other eye. Okay. So we're going to do that one first. Okay, so we will cover your right eye. Okay. So look at my shoulder. Okay. And tell me when you can see my fingers. Great. And I'll cover this eye, same thing. Wonderful. Good. So I'm just going to dim the light slightly. And I don't want you to look directly at the light. I'm just going to shine a light in your eyes just to see how they respond. To the light. Okay. Okay, so we're still using your eyes, but we're moving on to the ocular, motor, trochlear, and abducent nerves. These are cranial nerves 3, 4, and 6. So, we are going to do the pupillary light reflex, which is similar to what we've just done. And we are going to ask you to fix on a target in the distance with each eye. And then I'm going to shine the light into your eyes and just see the response. Okay. So, I'm going to cover this eye. Okay, I want you to look here for me. Thank you. Okay. And we're going to do the same with the other eye. So let's close this one. Now I want you to look at this pen. So I'm going to move it to different points, and I want you to focus on the pen, okay? So I'm going to hold it here and just focus with your eyes on that pen. Okay. And then here. Okay, and now I'm going to bring it. I want you to keep focusing on the pen. As I bring it, keep focusing on the pen. And back out again. And back out again. Okay. Good. So, we've done our pupillary light reflex, the pupillary accommodation. Okay, so just look straight ahead for me. I'm just going to look. Okay. I want you to keep your head still, and I'm just going to bring this across. So just follow the object as it moves across your eyes. That's it. Okay, and I'm going to do a H, so follow the object. Okay, do it again. Follows the object, moves. Good. Okay, did you experience any double vision at all throughout that? No, it was all okay. Okay, good. So we're going to do the trigeminal nerve, and both the sensory and motor branches of this trigeminal nerve are going to be tested. So we are going to do light touch and pinprick assessment. Okay, so sensation requires both light touch and pinprick. I'm going to demonstrate what to experience. So this is our light touch. So if I do this, see how light that is? And then we're going to use this. It will not be painful as the pinprick. Okay. So I need you to close your eyes. I'm going to gently touch around your face in different quadrants. Okay. And then I want you to let me know if you experience any changes in the sensation on either side, or if you can't feel the sensation at all. And I'll repeat it, so I'll do it with the soft, and then I will repeat it with the kind of pinprick. Okay. So let's start with this. So we're just going to gently. How did that feel? You could feel it all. Feel the same. Great. Alright, and let's do the same with this pinprick one as well. That felt the same. Good. So that's all fine. Then we're going to do the motor function of the trigeminal nerve. So I need to check the muscles of mastication. So I want you to clench your teeth tight for me, like this. And I'm just going to palpate for the contraction of your temporalis muscle and your masseter muscle, okay? And then I need you to open your mouth. Make your jaw from side to side. Like that. Then close your mouth again, okay? That's fine. Okay, and then I'm going to test your corneal reflex. So I'm just going to put the edge of this to the very edge of your eye. You'll not feel it, but your eye should twitch. Okay, so I'm going to do it on this eye. Good. And the other eye. Excellent. Okay. Let's grab a drink. So we are going to move on to the facial nerve now. So we are going to be assessing the muscles of facial expression. Initially assess for symmetry in the face at rest. So, yeah, just poker face. I mean, it looks pretty good to me. Okay. And then I need you to raise your eyebrows. Okay. Close your eyes tightly. Okay. Blow out your cheeks. Like this. Okay. And then smile. Nice big wide smile. Okay. Great. And I'm going to do the same again, but this time against my resistance. So I'm going to hold your forehead, so try and raise your eyebrows. Good. Okay, I'm going to try and peel your eyes open. I want you to try and peel them shut. Good. I want you to try and blow out your cheeks. Okay, and I'm gonna try and hold your smile. Good. Perfect. Done. Alright, we're gonna move on to the vestibulocochlear nerve. So this is cranial nerve number 8, and we're going to cover both cochlear and vestibular function. So the hearing can be assessed by whispering a number into each ear separately and making a distraction noise. So then we will do the Rhines and Weber's test as well. So we'll start with the whispering. So I'm going to whisper numbers. I need you to tell me what those numbers are. Okay, we'll start on this side. 12, 102, 64, 3, 1022, 46. Okay, and I'll do the other side. 7, 685, 22, 19,027, 6, 365. Alright, good. And then we will do the hearing test. So I'm gonna get this, and I'm gonna make a sound all around your ears with this. This is a 256C tuning fork, and you need to let me if you can hear it, and then when you can no longer hear it, okay? Okay, again. One more time. Great. I'm gonna put this down here. Okay. Hearing. Okay, perfect. Now we move on to your glossopharyngeal and vagus nerves. So we can assess them together. So I'd like you to try and cough for me. Okay. Good. Can you open your mouth wide and say ah? Okay, and then I'm going to use a tongue depressor to visual the palatal posterior wall. So say ah. Yep. Okay. Okay, and then we'll move on to the accessory nerve, which is a purely motor branch to the trapezius and sternocleidomastoid muscles. So we're going to get you to turn your head against resistance. So I'm going to put my hand here. I want you to try and turn your head to the right, okay? That's it. And again. Right, and on this side. Try and turn your head to the left. Against my hand. Great. And then I'm going to put my hands on your shoulders. I want you to try and raise your shoulders against the resistance, okay? Okay, so we did your sternocleidomastoid with this movement, and then with your shoulders, your trapezius. Okay, our final nerve is the hypoglossal nerve. It's purely a motor branch to the tongue. So, I want you to open your mouth for me. And take a good look in there. Okay, just stick your tongue out. And look at that, not any wasting. Or desiccation. Looks all good to me. Okay, and then can you move your tongue from side to side? Stick it out. And then move it from side to side. Great. Alright. So to finish this examination, stand back from the patient and state to the examiner that I've completed my examination. Well, I'm the examiner. I've completed your examination. And okay, now is there any other issues you have? Any neurological examinations required of your limbs? So have you got any loss of function in any of like your arms or legs or anything at all? Okay, did you have any questions at all about today's examination? No, so everything was absolutely fine. Okay. Alright. Well, it was an absolute pleasure to perform your cranial nerve examination for you today, okay? So if you have any other issues or any worries, by all means come back. If there's any changes to your smell, your eyesight, you get headaches, flashing lights, visual disturbances, and yeah, if you need anything else, just let me know, okay?